Yo.
You're already recording?
Yeah. Uh-oh.
I don't know if I can actually talk anymore.
Do I sound okay?
Yeah. You're not going to use any of this in the podcast, are you?
Yeah, all of it. It's all going in.
Okay, I'm going to just stop talking then.
Hey guys, it's Ivo.
Yeah.
Hey, it's Todd.
Hey, Todd. You know, it's weird doing this today because I just literally got back from being at the hospital where my uncle is, he's not doing well. He's going to be going into hospice care. So, you know, doing the podcast today, this very strange experience of like worrying about my uncle and then also thinking if any of this stuff would be usable for a podcast discussion. So, welcome to Device Squad, the podcast for the mobile enterprise from Propelics. If I seem a little somber today, that's why. It's been a melancholy kind of day. Device Squad, fighting crimes against enterprise mobility worldwide. Bad UI, frustrating user experiences, poorly conceived mobile strategies, we defeat them all. This podcast series will cover all aspects of enterprise mobility, including strategy, development, design, testing, and more. My name is Steve Brickman. I'm a mobile strategist and UX architect with Propelics. First, a brief history of the company. Founded in 2011, Propelics is a mobile strategy consultancy helping enterprises worldwide devise true mobile strategies and develop world-class mobile applications across all industry verticals. Propelics clients include large companies like Amway, Bright Horizons, Bank of Montreal, Dubai Airports, Family Dollar, DLL, Cintas, Merck, and many more. Propelics' menu of services includes 8 different mobile kickstarts, covering everything from mobile strategy and road mapping to MCOE to UI UX design to mobile testing strategy, along with soup to nuts app design development and support. Additionally, Propelics offers 3 homegrown enterprise mobile products. And today we're talking about mobility and healthcare, and we're going to run this one kind of forum style. We've got a few strategists here. Ivo Janssen, can you just give us your title and position?
Hey Stephen, I'm a solution architect with Kinvey and responsible for overseeing and architecting our client implementations.
And we've been doing a lot of work with Kinvey recently.
Yeah, it's been great.
We have mobile strategist David Enarson.
Hey, guys.
And Todd Chusid.
Yes, Stephen.
Thanks for hopping on, you guys. So it's a huge topic, mHealth. In fact, when I started doing some research for this podcast, I found a lot of stuff that was pretty old, like 2011, 2010, and a lot of it said that 2017 was going to be huge for mHealth. mHealth, of course, is the term for mobile health. You just put an M in front of whatever the word is and say you've got a new term. So, and it's a general term describing the use of mobile phones and other wireless technology, Internet of Things and so forth, AR and healthcare. It also includes the use of wireless medical devices for remote monitoring of patients. We're going to be going over all those different things and talking about current state of affairs and where we think that technology is headed. So let's just go around the room. What do you guys find most exciting about mHealth today, and where do you see the most potential for benefit?
So Stephen, what we see at Kinvey lately is a lot of patient engagement in eHealth or mHealth, where the patient takes control of the data from a number of perspectives. One of the more interesting things to me is where there is what we call a patient-reported outcome use case, where the patient actually sends back data about his health to the doctors. And that can take many different forms. It could be in the shape of a mobile app, where there's a survey, for instance, for drug addiction respondents. They take surveys about their state of their mental health. It can take the form of actual sensor data in an IoT fashion, the Internet of Things, right? Patches on the person's body that measure body temperature that get sent back and become part of the patient's health record.
This is really an amazing sea change as I see it. I'm sure like our parents are used to going to the doctor and never seeing their health records. They're invisible to them. And now all of a sudden we're able to talk about personal ownership of your own health data, enabling the patient to act not only as their own information source, but as their own best advocate. So, it's always such a problem when you have to call the doctor and you have to get health records transferred over to a specialist, say, and now we could just do that ourselves. We just have the data right there on your device and you can quick share it. Where do you think this is going? You think this is going to go more towards patient role of data management, or do you think the data is going to wind up in a cloud where it's just accessible by everybody?
The storage is going to be different from the ownership, whether it's stored on their mobile device and downloaded for access, or it's stored in the cloud and it can be transferred between systems. I think that's definitely going to play out, and it's going to play out due to the various regulations. But I think first and foremost, the patient is going to be at the center of their health data. I also see a trend in convergence of different metrics. You have, non-clinical data from, Fitbit and other devices. You have clinical data. That information is going to start to merge together into more of a complete picture of a patient, so the patient can really set goals and track their health progress. So that's a trend that I see increasing, and I see it adding value for patients.
How does privacy and security play into that? I had a conversation around IoT security on an earlier podcast. It was revealed to be sort of the biggest flaw in the IoT environment currently, just the complete lack of security or proper security. So it's a lot to work out when you talk about patients tracking their heart, information or blood sugar information from their own devices. As great as it sounds, how do we ensure that the security is there?
That's a very interesting point, Stephen. So I think what we've seen in the past with these IoT devices coming online outside of the healthcare space, for instance, we saw it in car manufacturing last year, where it turns out getting access to the controls of the car was wide open on the internet. There was just the whole security consistent of just the vehicle's VIN number as a header in the request, and that was it, right? And I think what we see a lot is that these companies that want to go mobile don't necessarily have the experience of playing in this mobile ecosystem. They're car manufacturers, they're hospitals, right? They're hardware manufacturers. First and foremost, it's really important for these companies to consult or to use these companies like Propelics, like Kinvey, that know what we're doing. We know about security, right? We've studied the HIPAA compliance regulations into great detail. We've made sure that all our tools, all our platforms are HIPAA compliant. A big part of this security play is just getting the right expertise and going from there.
It's just amazing the breadth of benefits that are possible with mobile. Everything from education to increased access to remote treatment, as well as remote diagnosis, IoT, and then we've got increased health availability to low and middle income countries is now suddenly possible. So it's just phenomenal. Even things that seem kind of mundane, like identification of meds, sounds kind of obvious, but with the opioid problem the way it is, one issue is how to track the transport of narcotic-based medications so that workers who are scanning the barcodes don't know the actual contents of the packaging. Things like that are real basic moves forward that can have an enormous impact. We just built a prototype for NBME, which is interesting because I was actually in medical school for a few years. Didn't quite work out the way maybe I had expected, but it was fun to go back and work on an app for the National Board of Medical Examiners that would help medical students get through their medical journey more smoothly in terms of, when is my next test coming up, and helping to prepare for the boards, and helping them to understand what their weaknesses and strengths are through daily questions and things like that. It's all very basic technology, but things that will make a huge difference later on.
Well, in hindsight, all the great ideas look so simple on paper, right? But you have to come up with them first.
Right. The other app that we're working on is for a small healthcare provider in San Francisco. And the issue of HIPAA compliance is constantly coming up because they're interested in creating a very robust mobile experience that really crosses the line between what a health insurer usually provides in terms of information. They want to sort of play almost the role of a provider. I hesitate to even say these things because these are the conversations that make them nervous. because of the regulatory issues. They can't offer medical advice. They can't suggest alternative meds or over-the-counter meds. They have to stay away from all that stuff. But at the same time, they want to offer added benefit, like here's your health dashboard, and pull information off of wearables, like how many steps did you take today, what's your heart rate been at, and so forth. So how do you think these HIPAA compliance issues are going to play a role in these kinds of apps moving forward for health insurance companies and for providers?
It's important, but if anything, it hampers adoption of all these cool technologies more than it aids them. Being HIPAA compliant is important, and once you're that, you can actually start innovating within those bounds.
I would agree with Ivo that it just kind of adds another layer that you have to review and make sure that you're following. There's complexity in complying with HIPAA, but as long as you're educated on what those rules and regulations are, you can kind of innovate within that framework. But you have to make sure that what you're building is vetted and validated, and not just the end solution, but all the supporting systems along the way are also compliant.
What I do think is interesting to talk about is having all these different uses come together, like the health net, the insurance data, the provider data, health record from the EHR, and then the patient reported outcomes like what over-the-counter medications is he taking, heart rate, Fitbit stuff.
Let's just go back and talk to this idea of ownership, because that's a very exciting idea. And then along with that, I think the biggest change that we'll see and the biggest benefit, at least from the patient's perspective, is this unified approach that we can now take. David, I think you introduced this.
Yeah, so in addition to unified, so like looking at unified from data and your health data perspective, I also think something that is going to continue to grow is what I consider like a seamless experience. And so if you think about the patient journey, their contacts with their providers, their contacts along the entire experience, I think that you're going to see continued innovation, and you're starting to see it. Like, for example, One Medical is building what they're calling a new primary care model where, you have a mobile app, you can use it to schedule same-day appointments, you can use it for, other functions, communicate with your physician via telehealth and things like that. So I think right now there's a lot of point solutions, and we're going to see, providers investing in solutions that are more integrated to create a more seamless experience for patients, because patients are going to expect it. If they want to speak with their provider, they're not going to want to go to a website and enter information into a portal, and then it sends a message, and then they get another message back and they can't reply to it. They're going to want a continuous experience, because that's what they're seeing in their day-to-day consumer mobile experiences. So they're going to expect that from healthcare as well.
Yeah, this is Todd. I think there's different levels of maturity associated with mobile healthcare or mobile unification, as David was saying. And we see it compared to a lot of other industries. I look at various levels of maturity. So, for example, are we creating apps that just provide educational information? And you also have to break it out by diseases, because I think certain issues in healthcare vary. So if you take diabetes as an example, they are probably one of the most matures around mobile healthcare, because they definitely provide you medical educational information. There are mobile devices out there that actually tracks and alerts patients. It's already getting to a point that you could provide support through different social networks, communicate with family and children, and potentially even reward behavior. But if you take those different elements, such as rewarding behavior, enabling communication with family and clinicians, track information, and you compared the number of applications or maturity of the applications that are out there, from diabetes to, say, for example, asthma or just pure arthritis, the maturity or the number of apps that are out there supporting those characteristics aren't there yet. So I think we just have to look at things, yes, as a unified patient experience, But I think by disease, it will be different in terms of how people mature through it.
And speaking to the future, I kind of envision that we'll have increasingly more independence and we'll actually spend less time in the doctor's office as we all start incorporating more of these medical devices and are able to wear them at all times. So the asthmatic or the COPD patient can have an O2 sensor that would alert the doctor at a certain point. That kind of thing can be just wearing these kinds of sensors in their day-to-day life. And then if there's a problem, the sensor would alert the doctor and the patient and whomever. And at that point, they would be called in for additional help.
I agree that the convergence of use cases that mobile enables here is just tremendous. What mobile really allows people to do is sit behind their phone and not so much go to a website or go to an app, but have an integrated experience of doing something that the user wants to do regardless of which app it is, right? Already, if you're looking at a contact, you click on the address, you will be going to the Maps app on your phone, but that's kind of seamless at this point, right? And the user doesn't care about applications per se. They care about user experiences and getting the stuff done that they want. So all these use cases, I think, are converging. Whether that's through an app or some other interplay between these apps is not really even that important. But to be able to go from your insurance plan details to see your costs and to schedule a consultation with a primary care provider or specialist about that procedure, those are all separate actions that used to be at completely different places in websites, maybe not even online at all. And I think what mobile will enable is to allow the user to just organically build these use cases out and navigate through an app or through use cases. And then with mHealth, really have an opportunity to interface directly with insurance companies through APIs, with the health record, augment this with the health data that the device itself gathers. And I think that's really where the power of mobile shines beyond of what was possible on websites in the past. And that's a big leap, in my opinion.
Yeah, that's really excellent. I found this bit from Rasu Shrestha, MD. She is Chief Innovation Officer at the University of Pittsburgh Medical Center and president of the UPMC Technology Development Center. And she makes this great point. She says, we want all of these intelligent insights provided to us at the right level of actionable information at the point of care. So we need to bring it back to where it's relevant, whether it's for the consumers or the patients or for the clinicians. And when you look at the promise of the Internet of Things and everything that we're making progress with in terms of analytics, it brings to us a whole bunch of other capabilities and solutions that we are only dreaming about today. One thing that's interesting that she points out is that another thing that this technology will help with is with the health of the network itself and with the health of the machines themselves, which you don't necessarily think about. It's kind of an ironic thought, but she says one of the big things we struggle with quite a bit in healthcare today is downtime. We've got all of these machines, all these systems that we're dependent on, and machines tend to break down. Machines tend to have a need to be taken offline for patches and upgrades. And she's saying one of the things that would be very promising in healthcare is that no longer would you have just one machine to depend on, but you could have a network of machines that are all connected to a secure cloud, and they would all equally share the tasks of monitoring the health of the network at large and the health of themselves. And they could be then self-healing and would provide alerts again when any systems were in danger. So in that way, we create a much more productive network and a system that's essentially never goes down. So that's really pretty amazing stuff. It's interesting because you can talk about seamlessness on so many levels as well. The seamlessness of task to task, tasks now being brought together so that the user can just go from one to the next in a logical fashion, but also the seamless experience of the patient in the medical system. So, and that can begin at home with wearables, with Internet of Things devices, such that, you know, the home or the patient becomes just a walking medical lab.
Yeah, that's definitely where I see all this stuff going. That seems to have some hurdles at the moment. What I've seen in building mobile applications and building these patient-reported outcome applications over the past year is a lot of hesitance from the providers, from the doctors, to allow patients to augment their own health record. Patients have the ability to view their own health record under the HIPAA regulations. We see that more and more, right? I've had a web portal, at least into my own doctor's website, where I can see my health record. And now we see that more and more going to mobile. But putting information back into the health record to allow a patient to edit his own health record is a whole other leap that I think will require a lot of buy-in or culture shift from the providers, from the doctors, before that can happen. But it's going to happen. It has to, right? You see it everywhere.
I think the challenge for some companies that I see is, where do they start, or where do they evolve to around mobile health solutions? So what I mean by that specifically is that, well, do you start with the critical issues, such as ambulances or notification emergency systems? Or do you start with developing mobile solutions around a characteristic of at risk, right? Triggers, alarms for independent living, or early discharge, for hospitals. Or then do you go to the other extreme, such as well visits, well-being for the segment. So while I think we talk about unification, I think we also have to focus on, where would things get improved, or what apps do you focus on around mobile health solution? Is it critical apps? Is it wellness apps, unwell apps, or at risk? And I think each one of those has their own different challenges. That's why it's important to layer in that maturity of the specific disease, such as diabetes, arthritis, etc. So while there is a unification, I think we have to also figure out how to start segmenting things a little bit more, because mobile health touches so many different channels, so many different applications. I see an opportunity to focus on specific characteristics first, whether it be critical, well, at risk, or unwell.
So are you thinking, like, before we get ahead of ourselves, creating sort of a common language so that when these different facets of healthcare are more developed in mobile, they're able to communicate more effectively? Or, like, I understand that all these different areas are being developed sort of simultaneously, kind of piecemeal. Is that kind of what you see as being a problem?
Yeah. I think people are piecemealing things right now. A lot of people are focusing on the provider or the consumer, but it's just looking at it from the perspective of, when we're doing that, what area of health are we focused in on? Are we focused on the well-being, or are we focusing on the risks or improving the risks associated with the patient? Because there may be different investments or different expectations or timelines. So all I'm saying is that right now we are developing very point solutions, which is okay, because that's how we start. But over time, those point solutions then for a company have to start being categorized in terms of, who am I actually helping, and how is it increasing my, whether it be value of my company or the brand, or the health, wellness, or at risk of my patients.
I did find something along those lines in terms of a common protocol problem. This guy, Stephen Miles, calls the Internet of Medical Things. And this Stephen Miles is a research affiliate at the Auto ID Labs and Center for Biomedical Innovation at MIT. He says that new healthcare IoT applications are becoming increasingly affordable and easy to use because of NFC, the high-frequency ID mini chips that are now commonly available in smartphones and tablets. But he says that the Internet of Medical Things hasn't truly arrived because device vendors have not agreed on common communication protocols. So hospitals will use devices from many different manufacturers, each with its own proprietary standards, and that's a big problem. He also points out, when we talk about this idea of creating a seamless experience for the patient in terms of, tracking a patient from intake to treatment to post-op to physical therapy, let's say, that there's a lack of a national patient identifier system, and that a national patient ID would help identify patients and the devices and meds they use. just as the internet identifies users by their IP addresses.
Now, there are solutions that are coming out, such as Propelics, which takes what you're saying as all these different areas, because they're one common component. So Propelics takes all of the M Health data, whether it be from Fitbit or Garmin or from Calorie Counter or MapMy. It's a cloud-based service that collects all of that data and pulls it into a specific database, irrespective of the device. So to your point, Stephen, is that I think that we'll see more of those common APIs being created, such as Propelics, which focus specifically on mobile health data connections.
I agree, Todd. It's a wild west out there, right? It reminds me a little bit of the standardization around CDs or DVDs back in the 80s and the 90s. Everybody is bringing a new protocol to the table. Because if you think about it, the backend systems, the EHRs, they had a protocol, standardized protocol for exchanging health information. And it's called HL7. And that works great from a backend standpoint between those EHRs. But there's really no way to unify that in a modern world. And there's a number of companies that are trying to address this with their API. Propelics comes to mind, Redox comes to mind, HL7 itself tries to do something with Fire. There's a lot of innovation here, and I think what we'll see is a lot of, call it, consolidation of these protocols for the next few years into the standardized protocol that everybody wants and needs.
Let's talk about AR, because I think AR is it's sort of a questionable area, I feel like, in terms of how much is really there. How do you guys feel about AR? Do you think there'll ever come a time when actually remote surgery will be performed via AR?
My answer is a very optimistic yes. And it's a while out. At Kinvey, we see a lot of companies wanting to do these integrations. We've had requests to build mobile interfaces to Watson, IBM Watson. Right now, I'm working on a project that's doing video streaming to provide exactly what you say, remote surgery capabilities to the table. Again, I think we're talking about a lot of long-term stuff here, but I see the enthusiasm and I see the drive to start implementing these things. And it's very early, but it's going to happen. I'm very confident.
Where AR will also help will be around communications or collaboration. So, for example, if you are in surgery, certainly you'll have the ability through AR to identify different items, organs, tissues, etc., get some instructions. But then when you're in your procedure, to have another doctor collaborate with you, who may be more of an expert or wanting a second opinion as you're going through, I look at AR as an element of enhanced collaboration, enhanced communication as a single person is going through something. So yes, they are going to help from an education perspective, but I think it will help doctors themselves around different point of views. So I think, Stephen, you were saying before is the patient is having more control and they're getting smarter. But I think the doctors will, with AR, not be so isolated. And hopefully they'll be open up to other means of collaborations with other doctors. Now, the issue comes around insurance or liability, which is above my pay grade, right? So if I'm an extension of that surgery, I'm providing communication and collaboration to that doctor, having an opinion. I don't know what the impact is from a liability perspective. And it's a shame that we have to think of things along those lines. But I think AR will start to introduce those questions even more around liability.
Certainly from an educational standpoint, the liability concerns aren't there, and it has huge benefit.
Yeah.
If medical students, across the country can all experience some sort of new surgery that's happening in real time and everything that's entailed there, or really, experience any aspect of a medical professional's day-to-day job in sort of a more close-knit fashion than just reading about it. Do you think we'll be seeing drones in the operating room anytime soon? Like similarly with cameras?
Well, since we're going to have a drone in our body, I'm sure it'll at least be in our a small drone flying around our internal organs and things like that. So yeah, I think you can definitely see a drone in a hospital. Simplistically, I always go back to the purpose, right, of the drone. Is the drone going out and bringing in new medical supplies if something is out? Is the drone used to communicate or alert someone? It all depends on its purpose, or going back to what's the use case of that drone.
There's all kinds of mobility. We're already seeing sort of mobile robots in hospitals that are replacing the role of orderlies, and bringing meds and things to various rooms, so forth. As you mentioned, these micro robots that will be perhaps traveling around in our bloodstreams at some point and diagnosing us from the inside and then texting us to let us know when things aren't right. So it's a brave new world.
Yeah, I think that what we'll hear always will be around the challenge of how do you keep it personal instead of robotic or automation. I think that's what the companies that are creating these things or the healthcare providers that are doing this, where does that line in the sand evolve to in terms of automation versus personalization? Because I think it'll evolve over time, because if you correlate that to kind of the generations, right? I think there would be a different expectation for the generation that is now of elderly versus the generation which is for argument's sake, is in their 20s, will become in their 70s. I think it'll be a different expectation. I think we have to base it off of that, the experience. I think the experience will correlate to certainly the generation, but I think we may see multiple applications developed. If I take diabetes as an example, could you see different applications developed for a specific generation? Maybe.
When I was at Beth Israel Deaconess this morning visiting my uncle, one of the things that occurred to me, and again, it's a completely sort of mundane, these days, mundane. I was just thinking, wouldn't it be nice if my uncle could have a large screen on the wall that would provide video chat with family members? A lot of family flew in to see him, and there's a lot of family that couldn't fly in, and a lot of friends that won't make it in time. Basically, a very simple thing to implement, allowing for video conference in each room and then an interface to allow access to the patient to provide a personal experience and open up. Again, we're talking about creating a seamless experience between your home life and your sort of medical life. And so in this way, sort of opening up the hospital room where a patient's in recovery or in hospice care to his social network.
Yeah, they do it on a small scale right now with cancer patients, people who are in critical condition, where they give you a website. You can log into that website. The individual spouse, as an example, could post a current update about their condition. So instead of calling 15 people, you can just do one post, and then that post then goes out to all the different people. I've used it before, where in that same post allows you to collect money for certain funds, allows you to provide meals to the couple. So some of that is happening, but to your point of right in the hospital room, I think is great.
Overall, the trends that we're seeing are towards empowerment of the individual with regards to owning their own data. And I think we're seeing this sort of democratization of health data and health care, I guess. Before we close, let's talk a bit about the benefits to low and middle income countries. I mean, obviously, huge benefits there.
I think that you're absolutely right. If you look at some of the third world countries in Africa, they skipped computers completely and went straight to mobile, right? So talking about mHealth, mobile health specifically, larger than just e-health, right now I have access to my e-health record on a website, but not on a mobile app, at least not my provider here in Austin. So the shift to mobile will be hugely beneficial because in Africa, everybody has a cell phone, nobody has a computer. So I think this is a really exciting space to bring more healthcare use cases to mobile apps to enable those folks also to have access and interact with their health records.
Just from Wikipedia, middle income and especially low income countries face a severe lack of human and physical resources, as well as some of the largest burdens of disease, poverty, and population growth. And healthcare access to all reaches of society is low in these countries. So this is a World Health Organization report showed that higher income countries show more mHealth activity than lower income countries. That's obvious. Countries in the European region, currently the most active, and those in the African region are the least active. So the WHO report findings also included that mHealth is most easily incorporated into processes and services that historically use voice communication through conventional telephone networks. They also noted an extreme deficit within the global healthcare workforce, with critical healthcare workforce shortages in 57 countries, most of which characterized as developing countries, and a global deficit of 2.4 million doctors, nurses, and midwives. In a study of the healthcare workforce in 12 African countries, they found an average density of physicians, nurses, and midwives per 1,000 population of 0.64. The density of the same metric is 4 times higher in the United States at 2.6. So you've got this double-edged sword where the burden of disease is much higher and the health care that's available is much lower. How does mobile come into play here in terms of actual care? Are we talking about, again, the more forward-looking AR solutions, setting up remote hospitals that are just populated by robots that are controlled by AR remotely? How does this work in the real world as a solution?
I think it's starting with getting information to them first. That's the real world. Information about their records, information about their disease, information on where to be treated. And I think that evolves from there. And I unfortunately don't know the quickness on the evolution.
Right, but even just the delivery of information could be just massive, right?
Yeah, because I think that's where does it make sense and will be the most impact.
Yeah. And education around hygiene, education around diet, things that we take for granted here as basic tenets of good health. And then we bring in the drones, the doctor drones. And the doctor drones will carry the micro robots that they will then digest. And then we will control those remotely from here.
And we will use Amazon drones to ship those drones to those places, I assume?
That's right.
We'll take their money through blockchain.
All right, good. Well, I think we've sorted it out then.
Yep.
Good.
Problem solved.
All right. This has been a very productive podcast. I think this may have been the most productive podcast so far.
Great.
Well, guys, thanks for hopping on.
My pleasure, Stephen.
All right, take care.
And thank you, everyone, for listening to another episode of Device Squad, the podcast for the mobile enterprise from Propelics. All right. Bye-bye, everybody.